Great.
Okay, good.
Hello, and thank you for joining me today. I've got such a special guest for you, all about talking about how to raise healthy kids. We've been talking for years, and I've been following her work for such a long time now, and she's been such a leader in telling us how to understand the interface between medical care and holistic care for parents and raising healthy kids. Dr. Elisa Song, thank you so much for joining me today. How have you been?
Thanks, Stephen. I've been great. The last time, gosh, it's been a long time. The last time we spoke, you were about to move to America and about to have a baby. So how old is your baby now?
So I've just had I'm not me.
Okay.
But we've just had our third. Yeah. So we have three under 3. Yeah. Yep. So we have a 2-week
my gosh. Okay, your life is crazy right now. Okay.
It is. I look a little tired, right? It's
That's awesome. Congratulations. That is so great. I love it.
Thank you so much. But yeah, it has been a little while since we've talked, but you've been really kind of progressing, this conversation as to how parents can really interface into how to raise healthy kids. For those that don't know you, you're known as the holistic pediatrician, but can you tell us a little bit about the time before you became that and how you first started to think about, how you could help parents to, raise healthy kids in this way?
Yeah, I always knew that I wanted to work with kids. I mean, even from the time I was little, loved to babysit and all that stuff, right? Actually, at first I thought I was going to be a veterinarian because I love pets too. They're pets, children, kind of on a similar plane. But then, in college, I actually didn't think I was going to go into medicine because I grew up in a medical family. I'm like, I don't like any of that, what I see. And I stumbled upon a conference while I was here at Stanford. It was a conference of the American Holistic Medical Association. And in it this was back, I'm going to date myself. This is back in the early 80s, right? And so this was now, there are people like Andrew Weil and Deepak Chopra and Joan Borisenko. These really, really well-known people. And back then, they were just getting started. And they opened my eyes to this field of integrative medicine. It was called holistic medicine back then, right? Alternative medicine. And that I knew right then and there that really was what I wanted to do. And so my journey kind of propelled me forward into medicine and really finding a path that I think is the only way that kids should really be cared for, is this more holistic integrative approach that really blends some of what we need with conventional medicine, but also understands that, things like antibiotics and antacid medications, if not used appropriately with the knowledge of the downstream effects it can have on the gut and the immune system, can end up sometimes doing more harm than good in the long run.
It makes total sense. And so you kind of came into this with this your kind of mission and purpose early on. I was wondering, what was your impressions, during medical training and what you were seeing in terms of, how your career would fit into this whole, the whole interface of trying to help patients to understand it and being a medically trained and registered doctor. And what were your first kind of impressions in that?
Well, it's interesting because I kind of bridge, I don't even want to call them both worlds, but there's two sides, right? There's a very conventional side, and that's what I train in. I train at UCSF, which is, really highly respected tertiary coordinary care hospital for children and adults. In this very conventional model. And even back then I was known as as a resident, right? Everyone's like, oh, you have a parent asking about vitamins, go talk to Elisa, right? Send the patients that way. So even then I was always known as, and what's interesting, so Lila Masson, right? She's a pediatrician in Sydney, and she actually trained with me, and she's an amazing holistic pediatrician, functional medicine pediatrician as well. And she kind of paved the way for me, because even back then as my senior resident, my residents co-residents would talk about, oh, well, go talk to Dr. Lila because she doesn't, she has questions about, vitamin K shots. Is that really necessary in kids? And, different ideas about circumcision, and, really kind of opened my eyes to this other way that we could really think about caring for our little ones. But it was very, very accepting, right? I mean, they were my close friends, but then leaving residency and really trying to forge this path. It's been, I don't want to say a lonely path because I've had a ton of support with my family and friends, but sometimes, right, it's been hard to find pediatricians who have been like-minded. There are more and more, but the conversations can get really tricky sometimes, around sensitive topics. And I don't know. I mean, it's been very interesting. I would never practice in any other way. I have seen kids getting sicker and sicker and sicker over the years, as we all have. But when a 6-month-old comes to my office diagnosed with Crohn's disease, there is something that we are doing wrong as a society, and relegating that little 6-month-old baby to a lifetime of immunosuppressant medicines is really not helping them thrive. There is a time and a place for medications, absolutely, and I'll prescribe medications when needed. But I think we need to think more globally about, especially, you have children, I have young children, how are we living in this day and age to really support our kids? And it's not just their physical health, but their mental health and their immune health and their cellular health, and really getting down to how do we unify all of that? Because we can no longer separate out, the mental and the physical health, right? With that, we know about the gut-brain connection. We're going to talk all about that today too. But, when we have our kids now with just this expectation from parents that their kids are going to be sniffly all the time, or have eczema on their cheeks all the time, or, oh yeah, my kid has reflux and they're on medicine, or, oh, of course, my kid and every other kid in their class has ADHD and is on medications. That shouldn't be what we consider the normal, right? But this has unfortunately become the new normal for our kids. And that's everywhere, right? It's in Australia, it's in the States. I mean, pretty much any developed country, this is the case now.
Absolutely. And as you mentioned before, I've looked at this across the world, and it is similar right across the spectrum as to what practitioners, but also parents are experiencing. We're seeing kids just not thriving, like they really should. And, from a dental perspective, we're beginning to look at it from development. But what you're talking about is that, kids are presenting in your office with a host of different conditions. Can you tell us about that rise of this chronic disease? And we mentioned a few different chronic conditions. Can you just tell us about how you saw this rise and how this has changed for parents? Because I feel it's been a little bit normalized in the last few years, whereas if we put it into this perspective that it's changed quite recently, it becomes a whole different beast.
Yeah, absolutely. And I think I have also at this point now I don't know if it's a luxury, but the knowledge of being a quote old doctor, right? I mean, I've been doing this for a long time. Been a pediatrician for 20 years, and life really has changed pretty dramatically. When I finished my residency back in 2000, which is like over 20 years ago now, I saw one child with autism in my entire, 3 years of pediatric residency. And I was told back then, if you go into private practice out in the community, you're going to be lucky if you see maybe a handful of kids with autism in your career, right? And then fast forward, I opened up my private practice 5 years later, and I was flooded with kids with autism and parents who were desperate to find answers, to heal their children. Just to give people an idea of the numbers. Now, this is in the States, but sadly, Australia very often mirrors what's going on in the States. Not that we are ones to follow by example, but really, this is from a few years ago. About 55%, so a little over 1 in 2 kids, were diagnosed with some sort of a chronic condition. And the estimates, if you go along that trajectory that we're seeing, over the years, by 2025, which is now when I was giving these statistics, I would say, well, it's almost a decade away, but now it's really, 4 years away, that number was projected to be 8 in 10 kids with a chronic diagnosis, 80%. And I'm not talking about necessarily really, quote, debilitating illnesses. Some of them are, because autoimmune illnesses, Crohn's disease, rheumatoid arthritis, ulcerative colitis, just inflammatory bowel disease, all of those autoimmune illnesses, PANS and PANDAS, are definitely on the rise and can be very devastating. But I'm also talking about these, quote, milder things that we as parents, we as a society are kind of accepting, as you said, as just, oh, well, that they're normal conditions, like kids should have them, like chronic constipation or reflux or sensory issues where kids just don't feel right in their skin, behavioral problems, ADHD, asthma. All of those are now considered normal childhood conditions. And, I can think back to when I was a child, and I remember there was one kid who did have peanut allergies, right? But now, the number of children with anaphylactic food allergies is startling. And, back in the days, pre-pandemic, when we had in-person field trips, lots of field trips at my kids' school, I was often asked to go on these field trips because I could, as a medical doctor, handle the medications that might need to be administered. And oh my gosh, the bags of inhalers and EpiPens and medications that I have to carry was astonishing. And then just being in my children's classroom, just the number of kids who just literally, they can't be in their bodies. They're rolling on the floor, they're, head down, jumping around, talking, and, just really having all of these, sensory concerns is really, it's definitely alarming. And so I don't want parents to expect that this is normal. I want parents to expect that their kids can be healthy and happy and vibrant, and that and also know that, I 100% believe, and this is my mission to teach parents, that with an integrative and functional medicine approach, I 100% believe that chronic childhood illness is both preventable and reversible. So that is, I really, really and truly hope that, parents can understand that. And if they are on a path of chronic conditions, to really seek out, as you're teaching, right, this broader way, this more holistic way of looking at health.
You say it so clearly and succinctly, and your life really kind of, shows, this dedication to try to unhinge this very difficult problem. And I was just thinking, that I think for a lot of parents out there that are experiencing this now, there's a two-pronged problem where you've got practitioners that are flooded with these issues that they haven't really been, versed in and trained in well to experience, how patients and especially children are experiencing this in society today. How would you say that a conventional approach to some of these conditions, or what are the common conventional approaches to, broadly speaking, that the parents are getting? Like, how would you describe that?
For sure. Let's just think about babies from, we'll kind of go with what usually presents at first. And so, there was a time when my husband and I, we took off time in between, like before I started my own practice, to travel around the world, because we thought, okay, once we have kids, it's going to be a little harder to do that.
No trouble with kids.
That's right. But I'm so glad we did that, because our mission was to scuba dive in as many places as possible. And that's a little harder to do with kids, but I guess we could have toted them up top. But starting from infancy, from when they're born, babies can have colic. They can spit up, right? All babies have reflux. All babies, their lower esophageal sphincter, that muscle between the esophagus and the stomach, is just like the rest of their body, is kind of floppy. And so milk will just easily kind of slosh back up and down. So all babies have that. All babies spit up. Whether or not we call it gastroesophageal reflux disease really depends on, how clinically significant is it. Is it affecting the baby's ability to gain weight? Are they, very, very uncomfortable, which can be confusing because babies around, 2 to 4 weeks of age can get more fussy as well. So the reason I mentioned traveling around the world was because back at that point, this was in the early 2000s, there were no antacid medications that were approved for babies at that age, right? I come back after this year and I work for my my friend's office, right, temporarily as I'm setting up my office, and all of a sudden my jaw dropped to the ground. I am shocked because now Zantac ranitidine is approved for use in infants for reflux. And I just thought, oh my gosh, like what is going on here? This very, first we're pathologizing something that could very well be normal, right? Second, we're saying that there has to be a medicine for this. And we're not thinking about, well, what does that mean? When can that baby wean off of that medicine? And now we know, flash forward, but 15 years later, this is now in 2017, a huge study was published. It was a military study, so nearly 800,000 children. And they found that children, infants who were given either antacid medications like ranitidine or antibiotics within the first 6 months of life had a significantly increased rate of pretty much every single allergic disease. Asthma, eczema, hay fever, anaphylactic food allergies, hives, you name it. And the researchers speculate, well, perhaps it could be because that, giving an antacid medication by changing the pH of your digestive tract is altering the baby's developing gut microbiome. Well, in functional medicine, we knew that already, right? And so I'm not saying that, antacid medications are completely off the table. Sometimes it may be necessary, but we know that, from a functional medicine standpoint, that baby's gut microbiome is really affected by mother's gut microbiome during pregnancy, mode of delivery, were you born vaginally or born by C-section, and mode of feeding, right? Are you breastfeeding, or is baby getting breast milk or baby getting formula? So all of these can impact the baby's gut microbiome, and that gut microbiome in that first 2 years of life is this golden opportunity to get a healthy gut microbiome that then will set the stage for a healthy gut-brain connection, a healthy gut immune system connection, a healthy gut endocrine, hormone connection. You name it. And so if anything is altering that, whether it's antibiotics, for Group B strep while mom's delivering, or antacid medications, or antibiotics for the baby, which may be necessary, we want to do everything we can to protect and nurture and nourish that developing gut microbiome. So that could be as simple as making sure that if baby's getting antacid medications, that you make sure that they're getting probiotics as well, probiotic supplementation. It could be, making sure that baby is, that mom is getting enough protein in her diet to pass on really good amounts of glutamine and zinc through her breast milk to help support a healthy gut lining. So we just want to think about these things in a global way. That study I'll share with you. I see that, I'm just looking at the Facebook comments, and I'll share the link to that study. It was Dr. Mitra is one of the authors, Mitra, but anyhow, it's things like that. So that, for reflux from a conventional standpoint, would be treated with antacid medications. What I would do is, if it was appropriate, I might do a comprehensive stool analysis to see what the composition of the gut is. I would definitely do a food elimination. Dairy is the number one culprit in infants who have reflux. Of course, gluten is so highly inflammatory. At that point, baby's only having breast milk or formula. So you want to see, okay, if the baby is on a cow's milk formula, maybe try switching over. If the baby's breastfed, then have the mom try an elimination diet. This was my sister. She eliminated first. Anyhow, it ended up for her babies, right, that it was actually eggs and dairy. So I had her do a comprehensive elimination diet for a couple of weeks. always focusing on, right? Because Stephen, as you know, right, the mamas to your babies, if they're nursing, are super hungry. So we never want mamas to go hungry when they're feeding their little babies. So you always want to have a plan and really focus on what you can eat, because you can eat awesome, healthy fats and healthy proteins and, unlimited vegetables and fruit. And so, we don't want to think about what we're taking away, because that really changes our mindset of how how healthy our diet is for us. Another example is eczema, right? So many kids with eczema, and I'm seeing more and more kids with more severe eczema. In fact, I had this beautiful, beautiful little girl. She was 4.5 years old, Ethiopian descent, gorgeous long hair, and the mom showed me pictures of her before she had eczema and then after she had eczema. And when she came into me, she was literally, it just broke my heart. She was literally almost like a scab from head to toe, because she just could not stop scratching. And she had bald patches all over her head because she was so itchy. And so the conventional approach is steroids, 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 right? I had one kid come in adrenal failure because he was on just topical, just skin, right? So everything gets absorbed through the skin. Now, sometimes you might need a little bit of eczema for a hot spot, but let's look at what is the body missing when we have eczema. We're missing our omega-3s and beneficial omega-6 like GLA. We're probably lacking in beneficial, gut flora, especially Lactobacillus rhamnosus. We likely are deficient in zinc, because zinc is required for skin healing. And then let's look to see, why is this kid's immune system reacting so much? What are some allergies? Do they have environmental allergies? Do they have food allergies or food sensitivities? So it's really kind of taking that approach so that eventually we can get that kid off of steroids. This child, the mom came to me because this kid had been in and out of the hospital multiple times for IV steroids, IV antibiotics. And the hospital, the next step was going to be to put her on cyclosporin, which is a heavy duty, chemotherapy medicine. So, and that's where I want parents to know before they go down the roller coaster, or if they are on that, snowball chain of more and more intervention, I would really strongly encourage you, whether you're in Australia or, here in the States or wherever you are, to find a functional medicine integrative practitioner to work with you alongside your conventional practitioner.
Yeah, it's pretty sad, really, when you think of such a severe condition in such a young child, and then obviously there's conventional approaches that, and I'm in a dental practice, so we use conventional approaches a lot, and they have their time and place. But when we don't have a pathway off, or we don't even have a plan or a perspective as to how these things happen, it really does, for a kid that's growing, it doesn't make a lot of sense to just pinhole them with this one type of treatment. So it makes so much sense what you're saying. You're kind of talking about this world of functional medicine and conventional medicine. I feel like in the time that since you've opened your practice, there's been a fair bit of bridging happening, in particular in the understanding of the mechanisms as to how these inflammatory conditions are occurring. And you're mentioning the gut microbiome a lot, and I really want to dive into that with you. But can you kind of explain the perspective as we began to learn about these things, about the gut microbiome and these amazing bacterial interactions we have within our body, how that began to kind of shift your view of what's actually happening, and how we use that understanding to better intervene and understand these conditions in our patients?
Yeah, well, functional medicine is really looking at the science that we have, and then trying to apply it clinically. So, the research has been there for quite a while. I think that in terms of really understanding, I'm hearing someone saying my volume is a little low. Can you hear me, Stephen? Okay.
I can hear you good. I'll just check. I think you're good. Yeah. I'll check.
Oh, it says, Dr. Lynn, your volume is low, not me.
Yeah.
But I hear you fine. So
I hear you fine. Yeah.
Okay. So in terms of let's take COVID for an example, right? Really, with COVID, never, ever before seen virus. And, when I mean, I don't know. Probably most people listening here don't realize, but my son was actually hospitalized with COVID back in March of 2020. I mean, the very early days of the pandemic. I couldn't even get swabs to test him back then, right? We didn't even know. It wasn't even actually called COVID just yet. It was just called SARS, CoV-2. And so, that with that, I dove into the research to find out what are the pathologic mechanisms going on. What are the inflammatory pathways? We know now there's the NLRP3 pathways. We know that there are a lot of other immune pathways that are activated. And what do we know from a functional medicine standpoint? Well, we know from a functional medicine standpoint, when we dive into the research, that we have tools to optimize a healthy NLRP3 inflammatory response. So there's not too much, not too little. And that's with things like melatonin, vitamin D, something called specialized pro-resolving mediators, which are my favorite supplement derived from omega-3 essential fatty acids. Now, when we take a look at that, I mean, I was so, in a way, blessed. I mean, mixed blessings looking back, right? But I actually was able to help my son very quickly recover and get out of the hospital using some of these approaches because he had all the signs of heading towards what we now call multi-system inflammatory syndrome in children, or MISC. Nobody knew what that was back then. Nobody knew how kids were doing back in March. Everyone assumed that kids would do worse with COVID than adults. And now we know very different. But he had hallucinations, he had headaches, he had mostly abdominal pain was severe. I mean, all of these things that were not, common COVID symptoms at that time that we know. And with melatonin, immediately his breathing turned around. And we were able to get him off oxygen. With SPMs, his hallucinations went away. With SBI, there's something called serum-derived bovine immunoglobulin, which is so important for gut health. He came back. I could see his eyes coming back. And so we have all of these interventions that, sometimes we just need to extrapolate and try. And, in a case like this in the pandemic, we don't have time to wait for all the trials, right? We need to use our brains to say, well, how can we apply what we're learning, from the data, from the science, to then apply it in a functional medicine way. And so from that, I was actually, I've been really, for better or for worse, I've just been so on top of the pandemic information. And now, of course, with the COVID vaccines in children coming out, I have a lot of families who are asking about that. But now what I'm worried about, I know we're kind of off topic a little bit, but what I'm worried about coming out of this pandemic is our kids have been so sheltered, right? I have parents calling all the time. They didn't get sick at all last year. It was great. And I'm like, oh, but is that really great, right? I mean, is it really good to never, ever get sick? And not really. I mean, I'm a little concerned, not hugely, I don't know. I'm a little concerned that kids, as they go back into school in more of a full-time way, especially in our fall, your spring, when most schools here in the States are expected to be open full-time, they haven't been trained at all, right? One theory of why kids might be doing a little better is because, your kids probably aren't in preschool just yet, but kids are germ factories, right? They're just icky, right? And kind of yucky, and they get sick a lot. But that's what their immune systems are supposed to do. And so one theory of why children actually do so much better with COVID than adults is that they get the common coronavirus all the time. And so their immune system has had practice. So even though this coronavirus is very, very, very different, they still have a little bit more practice with it than adults. So I don't know what it's going to mean for our kids to go back without having had this immune system training. But I'm teaching parents, how do we build up our kids' immune resilience so that they can be ready?
Yeah, it's such a great point. And really, we really want to be thinking about, it's an immune system. So it's an adaptive response to what we're experiencing. And that's exactly what we were designed to do. So I think it's great points that you bring up, that we're probably going to need to be considering that, if we've been in isolation, it's something we're going to have to think about. Are we going to have adverse responses? So, like these kind of, ideas and thinking just, to me, make total sense. But in terms of we're talking about, kids experience, it's a great point, kids experience, infectious issues, probably more so than adults. But then it's the chronic issues, isn't it, that really
Yeah.
kind of become the long-term burden. And, the one that springs to mind that even was around, when I was quite young, or more so than say others, is asthma and like the chronic inflammation. And it reminded me of the corticosteroids that you were discussing. How have you seen the view of asthma in terms of this, commonality, but also maybe connections to this other rise of inflammatory conditions?
Oh, I mean, it's 100% connected, because asthma really, there's asthma, eczema, and hay fever. They're all what we call atopic diseases. And so, babies who have eczema, what we really want to try to prevent them from doing is it's what's called the atopic march, right? They have eczema when they're babies and toddlers, and they develop asthma and they wheeze with every cold, and then they develop hay fever when they're older. So it's this kind of progression of this allergic disease after allergic disease. And we know now that eczema and asthma really do have this autoimmune piece to it. And so, this whole idea of inflammation, how do we lower our kids' inflammatory load? And how do we help our children's immune system, handle that inflammation in an appropriate way? Because one of the most important things to understand about inflammation is that inflammation is not a dirty word, right? A little inflammation is actually a very, very normal and healthy response to, let's say you have a cut on your arm, and then you look and you're like, oh, it's a little red. There's a little pus on there. That's all of your white blood cells rushing to the front to heal up that area, right? But eventually, after that area is healed, we don't want redness and pus anymore, right? We want that to settle down. So you have this whole kind of counter-regulatory part of your immune system that comes up and says, hey, inflammation, you've done your job. Let's go back down to baseline, right? What's going on for a lot of children and adults with chronic inflammatory diseases is there's an initial insult or multiple insults, as usually is the case in this modern world, where inflammation goes up and it goes up and it stays up. And this piece, it's like, oh, I want to try to regulate it. It's not enough. So then this part stays up and we just have constant fire raging. And so how do we, in conventional medicine, we have things like steroids, right? Inhaled steroids that just bring down the inflammation. I mean, steroids are like magic, right? If you've ever had poison oak, it takes it away like that, right? And sometimes you just have to, I know in Australia, here in California, we don't like to talk about forest fires, but it is an analogy that I use. Sometimes there's just a forest fire in your kid's body, and we need to just put out the fire. And then we have to build up with the functional medicine approach, and really get the terrain back healthy again, so that there's no smoldering embers. There's not a chance that the forest fire is going to, be sparked up again. So sometimes we need steroids to do that. But for the most part, we want to try to avoid that. And we want to see how can we build up this counter-regulatory piece, this homeostasis. And there's nothing in conventional medicine that does that. The things that do that, I already mentioned some of them, right? Vitamin D, specialized pro-resolving mediators, melatonin, meditation, mindfulness, EFT tapping, right? And why do I point to? And over this past year, I keep going back to, we have to figure out a way to help our children engage their vagus nerve from the very beginning, even from the moment that they're toddlers, right? Helping them to manage their emotional frustrations. Because I would say of all of the inflammatory sources that our kids have, we can point to, air pollution and pesticides in food and, plastics and cleaning products and the fire retardants in our kids' mattresses. And we can control that, right? We as parents, we don't have to buy that stuff, right? But with our mind, like the most toxic thing can be our own thoughts, right? How we manage our own anxieties and our stress. And, that's something that we can't just take it away for our kids. And in fact, parents, if listening, please, if you constantly are trying to make life easy and good for your child, it's not helping them because they're not learning tools to overcome the frustration when they can't get that square into the circle puzzle piece, right? Instead of saying, oh, honey, I'll do it for you, let them work through some of that frustration and learn that they can be successful. I mean, that's a silly example with the toddler, but it really starts there to then how as adolescents they can manage their stress.
Absolutely, and the mind body connection, and as you mentioned before, the gut brain connection. You know, we've more or less built that bridge, that physiological bridge to how the mind interacts with our body and how we can really control our body with thoughts. So it makes so much sense, and when you consider it, you know, when raising kids, you know, if you can install these kind of things early, you know, you're really, you know, potentially building kids that are very resilient to, you know, potentially issues that could cause them problems their whole life. So it's such a great point. I really want to dive into your, you know, your mechanisms and your the way you approach. But I actually wanted to kind of get your kind of overview. What's your take on why all this is happening? Like, how do you explain? I mean, obviously there's a lot of inputs here. We've kind of brushed them, but what do you think are some of the main inputs as to why kids are getting so sick today?
Oh my gosh. I mean, I think part of that's like, you know, we have to look at the individual kid and kind of peel back some of that. But it's funny, you know, when I was on another podcast interview, the host actually asked me a similar question. And I thought about it and I was like, you know, really? I think it was when the microwave came to be. Which is when I was a child. I remember like we got this shiny, I mean, they were little back then, right? This amazing microwave. I'm like, oh my gosh, we can have dinner so fast. And then it was all about eating these TV dinners, as they were called, right? And that, I think, I mean, life really changed, right? I mean, back in the 70s, there was that commercial, I don't know if I mean, you would not remember it, but it was this commercial where this woman would come, go through the door in this, you know, business suit, and she would like fry. It was a song. Like, I can fry up the bacon, I can whip it up in a pan, and never let you forget you're a man, right? Because this was all about like this superwoman, right, who could do everything, and that idea, right, that moms can do everything, work and take care of the kids and cook and clean. And of course you can be a super mom, right? And then the rush. I think that nowadays it's really this rushed, this lack of mindfulness to virtually everything we do, from eating and cooking. And, you know, what it's so, the way that it causes inflammation, that cortisol rise. I mean, psychological stress causes as much or maybe more inflammation than any physiologic stress or infection. And, you know, this pandemic, I mean, we were forced to slow down, right? But I'm already seeing, and you're probably seeing too, as life really has opened up. I mean, at first, like, oh my gosh, I have time to walk every day. I can sit and, you know, read with my kids every day. Wow, I can home cook every day. And now already, you know, I'm starting to see the rush again of, you know, driving kids to activities that are starting back up, and we don't have time to cook because they're coming home too late. And I mean, so I would say, I mean, honestly, that's kind of, you know, a little esoteric, but I really think it's this lifestyle that we've created, because what you know, the one thing that if we could bottle up in a magic pill, right, in a pill would be a magic bullet. Well, the two things, right? Sleep and exercise, right? Sleep and exercise, right? And that's as the busyness of life gets worse and worse, those are the two things that go to the wayside the first for most people, right? Even for our kids, is sleep and movement. So, you know, we'll see what the end of this pandemic brings. I'm hoping that you know, there were definitely, you know, silver linings in the pandemic for many families. And so hopefully we'll be able to keep some of that.
I don't know if there's anything esoteric about introducing microwaves. So that's such a great point, you know, because a lot of people talk about the 80s and like the rise of sugar, but there really was a shift, you know, in that decade before, when you start to kind of put things in the microwave. And recently, Right, like totally. And we moved house recently, and I have the privilege now of having this big barbecue and like this huge fire, which I now cook on. And
Yeah.
there's something about fire and meat and food that it brings certain like kind of elements out of it. And I was just standing over the barbecue, like, because I'm terrible with these kind of things, but like watching the the food cooked and thinking like, wow, there's something to this. Our ancestors used to sit around fires and prepare food in this way, and there was just there's a texture and a quality and of the taste of the food that you just don't get when you throw things in a microwave or even put something on a gas oven. So I really think there's something to that.
Yeah.
Yeah,
I mean,
totally.
it is interesting because, of course, sugar, right? Sugar is like one of the biggest evils. And, but the rise of sugar really, was, as you said, I mean, it was preceded by this huge rise in packaged foods, right? Packaged processed foods. And now look at it. I mean, the life of convenience, right? And I'm not going to say I never eat out of packages, because I do. But, back then it was really the marketing, right? Of like, this package of rice-a-roni, the San Francisco treat, and like we all had to have it, right? I mean, it's just insane how some things really get ingrained in you that, convenient and fast is better. Packaged foods are just as good, right? Formula is just as is better than breast milk, was what my mom was told actually back in the day.
And it's something that parents are flooded with today. And, I see it in the practice. I see it, throughout the community, that parents have all these convenient options, but, the kids are potentially affected. How would you say to parents that are living a busy lifestyle and have these, can see that there are these convenient options, how would you go about starting to approach, kids are very attuned to these kind of things now. They want the packaging. They want, the quick things that are shiny and so forth. How would you say, and how have you gone about being a parent trying to, maybe pare these things down in kids?
So I always start by talking to parents, as they're asking me the same question, really thinking about things as what we do most of the time, right? What we do most of the time matters. So really, embracing that sort of 80-20 rule, 90-10 rule, unless your kids are sick. I mean, if your kids are really sick, let's say with, Crohn's disease, and you're trying to get them into remission, that is the time to be 100% and ratchet down. But for the most part, if we live by the 80-20 rule and, don't, and not hover and stress and worry and nag, we're going to get further with our kids. And then the strategies with kids, it really depends on the age. I mean, ideally, we would be talking to kids about healthy foods. What are the strong foods? What makes your brain feel so good? What helps your legs run so fast from the time that they're toddlers, right? Even the time that they're babies and you're starting solids and saying, wow, look at this avocado. It's so good for your brain. It's going to, make you so happy. Great night's sleep. I mean, whatever it is, right? But talking about strong foods and foods that aren't strong for us is really important. So they get that idea. And as, before kids go to school, we have the luxury of, we total control over what they get on their plate, right? Once they get to school and they start seeing what all their friends are eating, that's another story. And so once packages come into play, I teach kids how to read labels. I actually taught a 6-week, it was a gut health, nutrition, food course, gut brain course for my kids' 3rd and 4th grade class. It was awesome. So we made kombucha, we made sauerkraut. I mean, super fun. But I talked to them about reading labels and looking at sugar content. And those kids, they were so excited because they knew we've first spoken about, well, what are your gut bugs? What feeds them? Like, what does it help you do? Who here in this room has ever been worried? Who here in this room has ever had trouble like sitting still? Who here in this room has ever had trouble falling asleep? I mean, hands up, right? And when they get that connection that, wow, your gut bugs actually can affect all of that. Right. So we want to make sure we take care of our good gut bugs. And then that's with, healthy foods and reading labels and, fiber and all of that. And so I had parents emailing me like, what did you do? This is amazing. Like they're going shopping and reading the label and say, oh my gosh, mom, look at this artificial flavor, right? Or wow, this thing has like 32 grams of sugar in it, right? I mean, like that's what you want, right? To educate your kids. And then when they're teenagers, there's another shift that happens because for teenagers, it's less about you as a parent, right? I mean, it's more about their peers. And so then it's about, hopefully, if you've laid those foundations, it's just letting them know, okay, honey, now you know what those good choices are, those choices that make your brain and your body feel good, right? And talk to them about what motivates them. Because for teenagers, being healthy is like, well, what do I care about that? I'm healthy, right? If they are soccer players, what is going to help you, run the fastest you can and kick the most accurate goal, right? Or I guess you guys would call it football, right? Or if they're a violin player, okay, what is going to help your brain remember your piece and be as accurate as possible? So whatever is going to motivate them. For teenagers, a lot of times it's their skin, right? What's going to help those zits, go away? And so, and then when they go to their friends' houses or, decide to go to In-N-Out for lunch, just say, look, just notice. All I want you to do is notice how your body and your brain feel after you eat those foods, right? That we've talked about that aren't such strong foods. So that way they can know how it affects them and make a better informed decision for themselves, right? And so, because it's all, a teenager is all about letting go as a parent and, helping your kids learn how to make good decisions.
It makes so much more sense. And something I've just observed with patients too is that when the patient takes on the importance themselves within their mind, and there's something that changes within the body. We talked about that, gut-brain connection, but if you're instilling that in kids, like that seems very powerful. And it seems that, your child's third year class really experienced that. And so, yeah, it's such a powerful piece that parents can pass on. And, if kids can kind of guide their own way, it's always better. Health outcomes are always better when a patient can guide their own way. So I think that's such a great piece of advice for the families that are really struggling with some of these conditions. So, I mean, we've mentioned Crohn's a lot, and I see this a lot in our clinic too. So we're in the thick of Crohn's, say, whether it's, say chronic constipation or, the child is just not tolerating many foods, will only eat a small amount of foods. They come into your office. How do you start to look at this, and how do you start to unpack the journey to get this child better?
Yeah. So, I mean, of course, as you know, and I know you talk a lot about too, is that how paramount gut health is. And so, no matter what condition's going on, whether it's anxiety or whether it is ADHD or eczema, or if it actually is a gut problem like Crohn's or ulcerative colitis, we always start with the gut, right? I mean, that's just the foundation. And so, and then, and I actually will talk to teenagers about that, because they'll or kids with ADHD, like, I poop fine. Why are you looking at my gut, right? And so, and then that's really important for them to realize that the makeup of our gut microbiome really affects the composition and the balance of our neurotransmitters. So I talk to them about serotonin, or that it helps us relax, helps us fall asleep, helps us manage stress, and dopamine helps us pay attention and stay on task and not get addicted to things. And that some maybe upwards of 90% of serotonin and dopamine are made by our gut microbes. And so then they're like, oh, okay. And so, and Doris is asking a question about PANS and PANDAS. Even for PANS and PANDAS, we have to look in the gut and see what are the abnormal bugs, the dysbiotic or dysbiosis, right? The organisms that are present. Is it yeast? Are there parasites there? In the case of PANDAS, where strep is causing autoimmune problems, is there strep in the gut? That's one of the triggers. And so we look at that. Then we look at, what are the food sensitivities that our kids have? If your kids have a lot of food sensitivities and aren't tolerating sensitivities, they have something called a, quote, leaky gut, which I'm sure you've spoken about. And we need to work on healing that. And we heal that with zinc, glutamine, digestive enzymes, probiotics, rotating our foods. And okay, there's this 4R protocol, right? In functional medicine, where first we remove anything that's irritating. which is like foods or abnormal bugs. We replace what's missing, so maybe digestive enzymes. We re-inoculate with the good bugs, which would be our probiotics, right? And then we rebuild the gut lining with gut healing nutrients like zinc and glutamine. Well, I learned the 4 Rs when I started out in functional medicine back in the early 2000s. And since then, they've added a 5th R. This 5th R is probably the most important R. Not only to get well, but to stay well, because I see a lot of kids where we actually get them into quote remission, but then they start getting sick again, right? And so we're kind of always chasing this. And it's probably because of this 5th R. The 5th R is rebalance, restoring the gut-brain connection, that gut-brain-mind-body connection. Because if we don't restore the vagus nerve and how the gut and the brain are communicating in that two-way street called the vagus nerve, we're not going to have long-lasting healing. We're going to have continuously a tendency to get an imbalanced gut microbiome and slide right back into leaky gut. Just emotional stress alone, psychological stress alone has been shown to change the composition of your gut microbiome without anything else different. Even change the microbiome, the vaginal gut microbiome of pregnant women. I mean, it's fascinating, right? And so, we can't discount when people say, oh, then it must just be in your head. Well, yeah, it is in your head. And that's actually not a just, and we really need to look at that because it's so important physiologically.
It makes total sense. And, it's kind of been the theme of the conversation, this connectivity of the body. And then too, that, kids do rebound as well. So I've found that these problems, whilst they're experienced, quite severely in kids can be very responsive to these kind of approaches, and you're talking about very simple things here. You're talking about giving the body what it needs, helping the child to kind of, understand what's going on in terms of, what inputs affect their health, and really, giving them the path to health. So it makes so much sense. One thing I'm finding in our practice and in the dental space in general is that kids aren't sleeping very well. And I'm sure you see this as a part of this whole spectrum. What are your approaches to kids' sleep, and when parents talk to you about sleep, or how is that linking to these kind of conditions you're seeing that presenting as either behavioral or gut issues?
Yeah, whenever we have attention or focus problems or behavioral concerns, we always have to look at the sleep. And, I guess that would be, it really depends on the age as well. Teenage sleep is a whole other story, and, how screens and that blue light affects your sleep. But apart from that, there are plenty of younger kids who really have trouble either falling asleep or staying asleep. Or sometimes they seem like they sleep fine, but the quality of their sleep is not good. Right. So, if they don't have restorative sleep, if it looks like they're falling asleep and there seems like they're staying asleep, it is definitely something to consider looking for sleep apnea. Right. A lot of kids that will have enlarged tonsils, enlarged adenoids. Now, the answer, one of the solutions may be to get those removed, but we also have to think, well, why are they enlarged in the first place? Let's go digging, into, what are they holding any infections in their sinuses, right? What's going on? Do they have allergies that haven't been identified? And so that's one piece. But then the falling asleep piece is melatonin, right? Is our sleep hormone, and serotonin is the precursor to melatonin. So I always like, well, what's going on there? And that's always going to be the gut microbiome, even still with sleep. Now, I will use melatonin even in little kids to try to reset their circadian rhythm, giving them a little bit of melatonin just to, get into a good pattern of sleep, and then slowly weaning that melatonin off, once a good pattern is set. The other thing too that can impact falling asleep is stress, right? Even kids can have an abnormal surge of cortisol at night that then just kind of, they're wired and they're awake and, they can't quiet their body or their mind. So there is a supplement called phosphatidylserine that can be helpful for that. But then it's really working on, meditations, visualizations, something called cognitive behavioral tools are really helpful for kids. One of my favorite books for helping with sleep is by a psychologist, one of my friends, actually, a child psychologist, Dawn Huebner, Huebner. And she has a book called What to Do When You Dread Your Bed, because some of it too, after a while, if we have trouble falling asleep, I mean, anyone listening, if you've ever had trouble falling asleep, I mean, just sometimes the anxiety of not being able to fall asleep is worse, right? Because it gets to be about, an hour before bedtime and you start thinking, oh my gosh, is this going to be another night where I can't fall asleep? And then you're laying in bed and you're like, oh, I still can't fall asleep and it's 2 a.m. So we have to break that cycle as well. And CBT is amazing for kids. And in fact, is the best form of therapy, most effective form of therapy for teenage anxiety. So Don Huebner also has some great books called What to Do When You Worry Too Much or Outsmarting Worry. And then there's sometimes the staying asleep piece, right? With the staying asleep, sometimes it actually is a blood sugar issue, right? So many kids and adults have blood sugar dysregulation. And I'm not talking about diabetes. I'm just talking about those kids that get so hangry that they're tantruming and on the floor and screaming. And moms know, dads know, okay, we better keep snacks with us all the time. And they shove in that, that granola bar, and then kids are calm. But then 2 hours later, it's a sugar roller coaster, right? And so sometimes it's really at nighttime, it's this sugar crash that they're experiencing that has them, gives them nightmares. And so working on blood sugar balance with, changing the way kids are eating and what they're eating and minerals like chromium. And then, there is a supplement called inositol that actually can be more helpful for the staying asleep piece than the falling asleep piece. But I will say, no matter what's going on with your kid, it is crucial to get sleep under control. Crucial, right? Because that's the way your kids actually release growth hormone in their sleep. I mean, when parents say, they look like they grew a couple of inches overnight, I mean, that might actually be true, right? Because that growth hormone and their brains, right? Memories are laid down in our sleep. So they will remember their schoolwork and their day's events better if they're sleeping. Our brain detoxifies. The volume shrinks almost by half at nighttime to get bathed by its very own special lymphatic system to take out waste. So, sleep is really critical. The vast majority of children and adults are sleep deprived. So, if you're getting your kids' sleep back on track, it's time to get yours back on track too.
That's such a great point, because I see so many parents that are sleep wrecked, and you really have to think about, how much energy can be going into healing a kid or, keeping kids healthy when you're, just barely hanging on yourself. So I think that's such a great point that, people really need to discuss more. The parents really need to take some self-care there, because especially for sleep, because often there's those periods where there's been a lot of sleep deprivation, and it takes time to get that back. I'm experiencing that firsthand.
Yeah. Hopefully that won't last for too long.
She's going well, but it's all a process, and I think that parents, really should need to take that self-care message. I love that you bring that up, Dr. Song. We're going to jump into where people can find you soon, but recently you've released some products for patients to help them rebalance their gut. Can you explain how you put them together and their rationale?
Yeah, so I actually, one thing that was really exciting about this pandemic is, at least in the beginning, when things were slower at the office, right, I had time to really think about how can I best serve families? What can I do? And so, of course, with online courses too, because not everyone has an integrated pediatrician, in their back pocket. And so, I've created some integrative and functional medicine courses around the pandemic for children and adults, and also, now have been able to find some amazing supplements to launch our online Healthy Kids, Happy Kids store. So these are supplements that I can't tell you how high and low I look for, like the best supplements for the ones that I want to give to my own children, right, and my patients. And so, with the ability to then, put my name on it, I'm able to bring these out to anybody. And, I know people ask, well, do we ship to Australia? We can't through the store. It can be quite expensive, unfortunately, but it's possible. But I have different immune support bundles that have different supplements to support your kids and adults' immune systems, that, especially as you guys are heading into your winter now, right? I mean, we're getting warmer, you guys are getting cooler. And so, as we expect cold and flu season, I mean, hopefully not be terrible, but, to rise as it does in the winter. And now that we're out and about, who knows what's going to happen with COVID. It's really important that we look to ways that we can make our immune systems resilient. I mean, even if we catch a flu, even if we get COVID. And then the most exciting thing, just literally last week, we launched our Healthy Kids, Happy Kids multivitamin, it is amazing. I never, ever, ever thought, and I know you're going to not be so happy with me, but it is a gummy. Don't judge me. But it's I never thought I would want a gummy, but it's a plant-based vegan gummy that's low sugar. I mean, lower sugar than almost any chewable or gummy multivitamin out there, and has amazing ingredients like choline, which is maybe even more important for your brain than omega-3, essential fatty acids. There's chromium that I mentioned just now for balancing blood sugar. It has folate, methylfolate, and methyl B12, which are the only forms of Bs and folate that you want, because many people have MTHFR or methylation problems. So anyhow, that I was super excited for that. So that there it is.
It's a great point too, and so important for the development of kids' neurological system. So it's very difficult to find these things together. So I was excited when I saw that you were bringing these things out. And I highly recommend anyone. And most of the audience here is in the US, so I'm sure they'll be able to find your shop and post to the US. Yeah. So and the programs that you've got online at the moment, what are they for those interested?
Yeah, so a couple of different programs. The one that I've had for a few years is called Everyday Holistic Pediatrics, and I did that because we don't want to necessarily use antibiotics at every turn when our kids get sick. So it's a 12-module online course. You can take it at your own pace or use it whenever you need for teaching you how to use diet and lifestyle, homeopathic medicines, herbal medicines, acupressure points, and essential oils for the most common acute conditions your kids would have: fever, flu, vomiting, diarrhea, sore throat, earaches, colds, coughs, you name it. So I have you covered if you need that. That's called Everyday Holistic Pediatrics. The two online courses that really came about because of the pandemic, the first one is called Functional and Integrative and Functional Medicine Strategies for the Pandemic. And it lays out in 3 parts. First part, how do we build our immune resilience to hopefully prevent us from getting sick in the first place? The second part is, from a functional medicine standpoint, what if you do get COVID? What are ways that we can, really heal up really quickly? And I've had, at this point now, like thousands of families who have really been very rapidly able to go through COVID and not have long COVID, knock on wood, right? And then the third module is integrative, holistic supports for COVID, going through different homeopathics, acupressure points, things like that, for all the different things that can come up with COVID, like cough and fever, anxiety, right? And then the latest one, which I will have another part coming up in June, is an integrative and functional medicine approach to the COVID vaccines. So when I taught this first one back in earlier part of May, the pediatric vaccines had not yet been approved. And it's a 3.5-hour masterclass. It really dives deep into the science of what are the risks of infection. We know 100% that there is a risk of autoimmune antibodies developing from COVID-19. That we know, right? We know theoretically that there may be an autoimmune risk, from these vaccines. So it's my way of really laying out all the research that I've done and helping people be comfortable with whatever decision they choose, right? I'm not there to judge or tell you guys what to do. Has to be an individualized choice. And then the next one is coming out in June as we get more data, because of course Pfizer was just authorized last week, literally as we are talking now, last week. For 12 to 15-year-olds, and it's expected to be authorized for young kids. And I know there's a lot of different thoughts about that, but I will host another masterclass on that in June, because that is, as a parent with, all the pressure, right, in society to get your kids vaccinated as quickly as possible without much data right now. I want parents not to have this, the words that keep coming into my mind are the tyranny of the urgent, right? If feels so urgent, but we have time to just, just kind of let's wait and sit, right? Never make any decision out of fear, never make any decision out of the sense of urgency, and just make a rational decision. So, and yeah, those are the three that I have right now online.
And they can find that at healthykidshappykids.com.
Yeah, so healthykidshappykids.com, and the store, because all the courses are also on the store. Well, actually not the vaccine one, but it'll be there soon. It's store.healthykidshappykids.com.
I can't recommend it more for people that are raising kids. It's such an honor to sit and hear your story and all the work you've done over the decades. It's great to see how this is all coming together to actually get out into the world and make a difference. And thank you so much, Dr. Song, for everything you've done. And I really hope to do this again soon. I can't wait to see what you're bringing out next. I can't recommend more for people to try your supplements and also your courses to really get their heads around how to raise healthy kids. Thank you, Dr. Song, for joining me again today.
Thanks, Stephen. I can't wait to meet your little ones. I mean, when travel opens up and when you guys let us into the country, I will be there.
Absolutely. We're going to organize that completely.
Yeah, for sure. All
Bye,
right,
Dr.